So I went to my local GP, and she had a feel of it, and she agreed that it didn't feel right. But she did say to me, it's probably nothing because you're only 31. If they had done the biopsy as standard for any age, not just over 40, they would have known when it was that tiny little lump of cancer. They would have done surgery and radiotherapy at that point, a year and a half ago now. And at this point, I would be cancer-free and going about my very dull life as normal.
Okay, so you've had this crazy diagnosis, this like life-changing, life-ending, ultimately, diagnosis. And there's not just you to think about, there's your partner, there is your children. So what kind of support is there for all of you as a family unit when you get that kind of diagnosis?
Okay, the simple answer for that is none. So we have support emotionally and mentally from our friends and family around us, which has been great. But as far as professional help emotionally and mentally, there is organisations for myself, so I can myself contact Macmillan. Sobel House, there is an organisation called Maggie's I can contact. I was referred for counselling, which is a specific cancer-related counselling, specifically tailored to terminal diagnosis cancer. That's all great, but my children and my husband, there is nothing on hand for them.
So you're almost having or needing counselling, not just for yourself, but because you are then that support for them, because
absolutely, yeah.
So like you didn't have enough to cope with the whole treatment and the diagnosis thing, you need to be also providing that support for your family because it's not there. Not that they would feel like, oh, you should be supporting us, but just because as a mum, as a partner, that's exactly how you feel.
I genuinely feel that it is my responsibility as a mummy, to protect my children. So my children understand what's going on. My youngest, who's 3, he doesn't, but my daughter is 7, Erin. Alfie is nearly 9, and they fully understand that mummy has cancer, which is terrifying. It's terrifying for an adult to comprehend. For 2 small children, the word cancer is terrifying.
But also watching physical changes in you, seeing you go through, because the treatment has been brutal.
Really brutal,
You look amazing, hey, let's not forget. But the treatment has been brutal as you've been going through it.
The chemotherapy has been hard going. Sometimes really hard. I went 2 weeks where I actually physically couldn't see my children because I couldn't look after them, and I was emotionally on the floor. And so that was upsetting for them because all they wanted to do was be with me, and they couldn't.
And there's no support, there's nothing that steps in.
So I inquired because my eldest, Alfie, he's found it really difficult, emotionally difficult. Knowing that mummy is going to die is frightening. So I inquired via my doctors, via my oncologist, the Maggie Centre, Sobel House, Macmillan, even the school, and the only organisation I was given for the children was an organisation called Cecil. They're bereavement counsellors for children, so I contacted them, but they only get involved with counselling children or supporting children of terminal cancer patients when you're at the time of end of life.
Oh, so you're not sick enough, darling, for your children to get that support.
I'm not near death enough at this time for my children to require support.
And actually, that's not on that charity that they don't do that. It's more that this should be. I don't even think it should be a charitable thing. It should be part of your care from the hospital. Part of your treatment and everything should be supporting your family. Just because otherwise that burden falls on you. And like you've got enough to be dealing with.
I imagined as standard, when this journey began with the metastatic side of it, that as standard help would be provided to help get my children through it, because okay, yes, I'm not dying on my deathbed right at this moment in time, but my children and my husband have to get their heads around the fact that is a fact of the situation. They have to get their heads around the fact that the treatment makes me ill. All of that I then have to try and protect them from. But they are then trying to protect me at the same time. So none of us actually talk about it.
Right.
Me and my husband, we don't talk about it. We avoid that because he doesn't want to upset me. I don't want to upset him. We don't want to upset the children. So we all protect each other. Whereas what I assumed would be offered to us was an outlet to be able to get all of that out, either together as a family or individually. But that isn't there for any family. That's not unique to my situation.
Yeah, that's just
or
not
my,
how it is.
Yeah, or my breast cancer. That is how it is. Support is given to the person with the diagnosis, to the point where my oncologist actually said to my husband in one of our settings that the help was focused on me because I was the person going through it, not him, which is not true. We're all going through it together.
Yeah, of course. Yeah.
This is our new norm now. This is our life and death now. And they have to just get on with it. 8 years old, 7 years old, 3 years old, and my husband, who are all going to be left behind when I'm gone, have to just get on with it.
And actually, at this point in time, they don't know how long that period of time is. So
no, it's
you're
purely
still undergoing treatment, and so that's
purely based on how my body responds to treatment and for how long. It can change any time, but they will not be offered any emotional support until the time that it starts going horribly wrong. There's no preparation beforehand, and there's no support for the situation now. Because the situation now is that we have this diagnosis and we have to find our new norm and live with cancer. There's no support to emotionally prepare them or enable them to live with cancer.
Okay. I just want to say thank you for coming in and doing this.
Thank you for having me.
It means an awful lot. And in terms of, we were talking earlier about breast cancer awareness and wear it pink and all the pink stuff that goes on, and how we know that people are just like aware of breast cancer.
Yeah, breast
it's not
cancer
like
is a word. Everybody knows what it is.
Everybody knows what it is. But the difference between breast cancer and metastatic breast cancer and what it actually all means, I don't think people are aware of at all.
No, and I think people need to realise that when somebody has metastatic breast cancer, yes, it's horrific, and yes, we're going to die, but we are still who we were before.
Yeah.
Before being called cancer, we were Jane, Joe, Julie, Charlie, Anna. You know, we were people. We are still those people. And it's okay to carry on and treat us as those people. It doesn't all have to be about cancer. We're still people. And the other point I want to make is that if you find something that isn't normal, no matter how old you are, make sure that you push for every test possible to completely 100% rule out anything, because cancer doesn't care about age.
Okay. Thank you so much.
Thank you for having me.
This. Thanks.